Hi, baby boomer fans. We are Jackie and Janine, the Pfeiffer sisters, and love to talk about the 1950s, inviting you to reminisce with us as we explore experiences of that decade. Grab your favorite malt or Green River. Make sure you are wide awake and get ready to be inspired about the 1950s. Welcome to the 1950s Fun Chat. Hi, friends. It's almost time to say bye-bye to 2024, and we are so glad that you've been joining us for many fun chats, we hope, all throughout the year, 52 of them for 2024, and moving on into 2025, telling the opportunities of the 1950s and how influential that decade was in the lives of so many of us who lived in that time. Jackie, what do you think about this next fun
What
chat?
do I think?
Well,
I
number
think
173.
I think we're glad to be here, and welcome to everyone who is visiting us by way of video or whatever method you're using. I do want to call your attention to the lower bottom there, the purple banner that has white lettering saying www.whilethewindmillwatch.com. Please go there for all sorts of information about Janine and me, about our vendors, and about the previous 1950s fun chat. We've had about 170. So, and also about the book. And the book is is up in the right-hand corner. And that little book has spurred the 1950s fun chat because it has provided a platform for people to tell us of their 1950s experiences. So the book was published in 2021, and that little white dot there came to us in 2022. It's an award that was given to us by the Independent Press in the regional category as the distinguished favorite. And it was in the regional category because our region of rural region in North Dakota was emphasized during the 1950s. So let's start with our guest today.
Yes.
Her name's Joan Bachman, and she was born in 1938 and grew up on a farm in Lemoore County, North Dakota. She married Ken Bachman in 1960 and moved to a farm in Ransom County where they had 3 children. They did later divorce, however. Those 3 children, though, have given Joan 5 grandchildren and 7 great-grandchildren. For 10 years, Joan served as administrator of the South Dakota State Survey Agency, the state and federal regulatory agency for healthcare facilities. Joan is retired from being a registered nurse, a licensed nursing home administrator, and a registered health information technician. Her lengthy career has afforded a wide range of learning by doing. In 2023, she self-published her autobiography. So, Joan, we welcome you to the 1950s Fun Chat.
Thank you for the invitation.
You're very welcome. So let's start out with what was entailed in nurses training during the 1950s.
Well, I attended a diploma school, the Mercy Sisters in Valley City. Diploma grads do 3 years with 1 month off each year of actual nursing care. Mm-hmm. Our first 6 weeks was book learning, but even after 6 weeks, we started having to listen to me, having to go to the hospital in the morning and help patients get ready for breakfast.
What did that entail to help patients get ready for breakfast?
If they could get up to go to the bathroom, wash their faces, straighten their beds, get their bed cranked up, and get the bedside table over their lap.
Okay.
Yeah. Mm-hmm. And then as we finished school, we took 2 classes of school at Valley City College. Most of the time we walked from the hospital to the college, which is practically all the way across Valley City.
Oh my.
Right. So we were in fairly good shape. The station wagon gave us rides when the weather was really terrible.
Okay.
Oh, the nice
That
station
was-
wagon of the 50s.
Yes. So what, how many students were in your class, and were you all female or was there a male?
all female. There were 20 of us to start with. I
Mhm.
think we graduated with 18.
Mm.
Mhm.
Some got weeded out, some quit, one got married.
Mhm.
Okay. So tell us about your dorm situation.
In the dorm, there were 24 of us, I think, on the second floor. 4 girls to a room with a cot and
Mhm.
a small dresser, 1 bathroom for the whole floor, 1 telephone for the whole floor.
Mhm.
Um,
Mhm.
Times were quite different back then.
Yes. And did you use that telephone very often?
No, we did not. No, there was no need to. We were
Yeah.
busy most of the time, actually.
Mhm.
We had to go to chapel at 6:30 every morning.
Okay.
Some of the girls, it was only the Catholic girls that did this. If they didn't have to be on duty, they would just put their coats on over their jammas and run to chapel because the nurses' residence was across the parking lot from the hospital. Anyway, I don't think us Lutherans dared do that.
And so when you were taking classes, what would they focus on the sciences?
Right. Yeah. And at school, it was anatomy and biology. And I think I remember we had to take English, which is fine because actually in this day and age, nurses write a lot. We didn't write very much back then.
Mhm.
Chemistry and biology and anatomy we had.
Okay.
And then we had 2 nurse instructors that did classes at the nurses' residence.
How do you remember how you were treated by the doctors as nursing students?
If you would read my book,
Oh, okay.
I
Give us a
remember.
clue.
Well, in the first place, of course, it took a long time for my knees to not automatically straighten up when a physician walked into the room.
Uh-huh.
When the doc came in, you stood up no matter what. But I remember making rounds with one of the physicians. I was a senior, I think then, maybe. And he wanted to check the patient's chest with the stethoscope. And so he told me to close the window. Back then we had the windows open because, of course, we didn't have air conditioning.
Uh-huh.
He told me to tell the guy to shut off the lawnmower. We were 3 floors up.
Oh.
So I shut the window, figuring that would take care of it. And he said, no, I told you to get rid of that noise.
Okay.
So I went downstairs, told the lawn guy to go on the other side of the hospital,
Uh-huh.
went back upstairs, and Dr. Merritt said, I told you to have him turn it off. Will you do that? And so I went back downstairs. So that's how it was then.
Yes.
Did they respect the work that you did as nursing students?
I don't remember feeling that at all.
Uh-huh.
Yeah, I don't remember feeling respected by the physicians at all, but not disrespected either. We were just part of the furniture.
Okay.
So then in the 50s, if you were a nurse, was it pretty much just hospital or clinic medical care, or were there other opportunities for nurses outside of a hospital and clinic?
There was public health,
Okay.
the county public health, but outside of, and maybe, there must have been some school nurses, but that wasn't usual.
In big cities.
Right.
Yeah. Okay.
Well, our county school, our country school, had Miss Jean Norton as our county nurse.
Oh,
And
you did?
Yes, and she would come in, I don't know, twice a year maybe, and give vaccinations to all the students who needed one.
Oh, for heaven's sake. Okay.
And she was very prim and proper and pretty. And she wore a hat, a little cap, and white shoes and white stockings, and The whole-
And a skirt, not pants.
Oh, of course.
Oh, right.
Yes, yes.
Yes.
So speaking of hat, tell us about all those. Sometimes we've seen stripes, little tiny stripes on a hat, a nurse's hat. What does that mean?
So for the Mercy grads, we had one stripe was for freshmen, 2 stripes for our second year, and 3 stripes when we were seniors. And then when we graduated, we had the stripe all the way across the top.
Okay.
Got
So
got rid of the vertical stripes.
okay. So how long, as a whole or in general, were caps worn by nurses? When did they go by the wayside?
Sometime in the 60s, late 60s, I think.
Mm-hmm.
And that was about the same time that we got up the courage to wear pants, I guess.
Oh.
So yeah, otherwise it had been skirts until then.
Did you have to have permission to wear pants?
No, because by then I was out of, that was when I was working in the late 60s.
Oh,
Okay. Uh-huh.
okay.
And in changing those stripes on your nurse's cap, is that something that you had to do as a student?
Yeah, we when we washed our caps, we dipped them in stiff starch and plastered them up because our closets were steel cabinets, so we just plastered them on that. And then we used lubricating jelly to put the stripes on.
A lubricating jelly.
And they stick, and it stays.
Yeah, they stuck.
Interesting.
Yeah, that's a little secret there.
Yes. Yes.
I was going to say a little more about the uniforms.
Uh-huh.
My schooling cost less than $1,000 for 3 years.
Wonderful.
Oh.
And I got a scholarship from the state of North Dakota because I promised I would work in North Dakota for a year after I graduated.
Okay.
Well, they got that back and more. But we had cotton muslin uniforms, skirts, and the hospital laundry laundered them and ironed them for us. They were provided as a part of our tuition.
Okay. Were you ever a candy striper, Joan?
No, but I started a candy striper program when I was at the Lisbon Hospital.
Oh, tell us about that.
We had kids from high school, and the auxiliary made pinafores for them. And some of the nurses did some training for them so that they knew how to act around patients.
Uh-huh. Good.
And some of them went on into nursing school.
Mm-hmm.
So that was good.
Were there many nursing schools in North Dakota in the 50s?
I don't, how many, I don't know. The ones I can think of were Catholic.
Okay.
St. Luke's had one.
Mm-hmm.
In Fargo.
In Fargo.
Mm-hmm.
St. Alexis had one in Bismarck.
Right. And Trinity, I think, had one in Minot.
Mm-hmm.
Oh.
And beyond that, I can't. A deaconess may have had one up in Grand Forks. I'm not sure.
Okay.
Was that the only way to get a nursing education?
Right. Yes.
Okay.
Right then. Yes. Although when I was, no, that's not true. When I was a senior, instead of a nun being the director of nursing, they hired a baccalaureate nurse to be the director of nursing. And of course, we knew that a baccalaureate college nurse couldn't possibly know a thing.
Maybe she knew more.
She maybe knew more, but not about patient care.
What do you recall some of the first things that you learned about patient care?
I guess the patient is right. The patient needs to be cared for with compassion. We didn't push them. It was so much different. There's no comparison. There's no comparison.
Mm-hmm.
It was to keep them comfortable and keep them fed. I guess that was the main thing.
Okay.
Yes.
And at that time, were the patients mostly in wards, hospital wards, or were they in semi-private rooms?
We had 2 wards, I think, otherwise semi-private rooms. And in one, actually, there was a back room. Some couple of old guys actually lived back there.
Oh.
Right.
Why was that?
There weren't any nursing homes, of course, back then.
Oh, that was.
And they weren't able to live on their own, and so they lived back there.
So it's was kind of an assisted living quarters.
It sort of was, yeah, right.
All right. Do you remember much about the menu, the food menu that was offered to patients and even to you as students back then?
It was just plain good food. Beyond that, I don't remember. In the 50s, I don't remember. Starting later in the 60s, then we became much more aware of diet, for instance, for diabetes and that kind of thing, and gallbladder and those things. But no, let's see. I had never. I don't know why we had never at home had chipped beef on toast. And so that was one of my favorite foods in the cafeteria.
Mom would make that too. Dad liked that a lot.
Okay, we never had it at home.
Well, that's a real fast food preparation.
Yep.
Yes. Did you have it over toast or potatoes, mashed potatoes?
Oh, toast.
Okay.
Yep.
Okay. So what was the typical day? Maybe you can't say this, but about a patient that's in the hospital. There was a routine that you followed, and then of course you change them per as fitting each person.
Right.
What was the
routine? They were awakened between 5:30 and 6, ready for breakfast with the face wash and so on. And then a bed bath. Everybody got a bed bath every day. The linens were changed. And the doctors made rounds between 8 and 10, generally speaking. At noon, it was, we didn't have physical therapy. The treatment that we gave patients was so much different. So much different. If they had back trouble, they were in weights. We attached weights to their legs. And hung the weights over anyway. But at noon, we repeated the face wash and bed straightening at noon. And then they could nap in the afternoon or have visiting hours. They may have gotten a back rub in the afternoon if they couldn't get out of bed. And then in the evening, again, it was the face wash, straighten the bed, get them ready for supper at 5:30-ish or so. And then at bedtime, start about 8:30 or so, back in, make sure they needed, if they needed to go to the toilet, whatever. And then they got a back rub again. So it was, we concentrated on care of the body and visiting with the people.
So connected. Oh, go ahead, Jenny, if you want.
Well, I'm curious to get back on the menu. Was there only one item that was served per meal, or we did?
No, it was a regular meal. No, we had regular meals.
But did the patient have a choice in what they would get?
No. Oh, no, there was no patient choice. No.
Okay.
Okay. So
we were all farmers. We knew you ate what was on the table.
Yes.
So were there any was there a physical therapist or of some sort connected to the hospital?
No.
Or was that separate?
There was nothing. There was nothing in town that I was aware of.
Okay.
Well, Joan, when you became a nurse, received your nursing degree, did your daily responsibility enlarge to become something more than face washing and back rubbing?
Yes, we started. That's good. we had to learn. We started passing medications. Did blood pressures and temperatures.
Yeah.
Tested for blood sugars. And then gradually assumed. There were some nurse aides. They had so many students that they didn't really need nurse aides. But eventually we were given the opportunity to be the lead nurse with somebody in charge of us, but at least we were given the opportunity to learn how to direct the people that would work for us.
Sure.
Mhm. So when you graduated, what were the options for you? Were you just, I could go to be a nurse in a hospital or a clinic or whatever, but you ended up in business.
Well, that was many years later.
Oh.
Yeah, I worked for a year at Mercy after I graduated. And then I got married and moved to a farm by Lisbon and worked in the Lisbon hospital for 21 years.
Ah.
Started there as a staff nurse, and then I was director of nursing, and then I was the administrator. We built a new hospital in the process, so I learned a lot. 16-hour days are kind of tough sometimes.
Yes.
Yes. And were those 5 days a week, or was it a 10-day shift and then you had off so many?
Everything was 8 hours. We never heard of a 12-hour shift. So
Okay.
it was always 5 days a week, right?
So did you have any connection with wasn't there the veterans or the old soldiers home or something like that in Lisbon?
Right. And yeah, the vets home. We didn't actually have any connection with that. In 1967, we built a nursing home onto the hospital. So we had a hospital nursing home combination.
Okay. Nice.
Right.
And Joan, when did you go into nursing in South Dakota?
I started in 91. By then I had been in Cooperstown for 5 years and in Sterling, Colorado for 5 years, and went to the state of South Dakota in 91 as the administrator. I still couldn't believe they hired me because I hate regulations. I've got a stack of. I've got a notebook full of letters that I've written to legislators, congressmen, Secretary of Health. They hired me. And I was there for 10 years, and that was actually the best job I've ever had. I loved it.
What made it the best job?
Because I could say this out loud. I wrote it in my book. South Dakota operates entirely differently than North Dakota as far as regulating healthcare facilities or as far as many other things. By the time I left North Dakota, the big hospitals were trying to eat up the little hospitals. And when I went to South Dakota, the big hospitals were helping the little hospitals. They weren't eating them up. And so it was mostly the small hospitals that needed attention anyway. And so I had the experience. I could help them understand the regulations. I could go to bat for them when they had troubles complying with the regulations. North Dakota had a task force for years that I was a part of, trying to diminish the rules for rural hospitals because we shouldn't have to follow the same rules. And it was when the same operational rules. When I was in South Dakota, I was able to certify the first critical access hospital in the United States. So I had served on the task force for years, and South Dakota was the first hospital that was granted the opportunity. West Virginia came the day after.
Oh, yeah.
Wait, did you ever go before Congress in the talk?
No, I did go before the CMS survey agency. And that was not fun. We were proposing a different way of evaluating compliance for nursing homes that was not punitive, and the feds didn't think that was a good idea. And I hadn't prepared myself as well as I should have either.
Speaking of nursing homes, you were involved with nursing homes,
correct? At
one time. What responsibility then did you have?
Director of nursing, and in fact, in Lisbon, the nurse aides weren't required. That was in '67. Nurse aides weren't required to have special training, but I trained some of the ladies that wanted to be nurse aides in the nursing home. I got the mannequin from JCPenney store, and we bathed her many, many times.
Yes. Yes. So other than your training, did these people, these ladies, have to go to any official schooling?
No,
Oh, okay.
Nothing, huh?
no, they were just taking care of their neighbors. He said, I mean,
Mm-hmm.
that's what makes rural, I think, so entirely
Mhm.
different. At least it did more then,
Mhm.
because we were taking care of our teachers and our aunts and our uncles and the people that we'd known all our lives.
Mhm.
Very much so. Did you ever experience a time where you had to transfer a patient from a rural health care situation to the city,
Right.
and then did they come back? Were they ever coming back to the rural hospital again, and you for follow-up care?
Right. Yes. And actually, the rural hospitals were given opportunity to have nursing care beds in them, swing beds,
Okay.
so they could dual license some of their beds,
Mhm.
which in some instances, of course, was competition for the nursing home.
Mhm.
Yeah,
Mhm.
we had swing beds in Lisbon as well as the nursing home. And by then we had a physical therapist who was working with patients.
Okay.
When did hospice ever come into play?
Mm. That must have been in the 80s. I was in Sterling, Colorado, and we started a new hospice there.
Oh, okay. And that was a different type of certification then, even than what?
Yeah, that's a whole separate program. Generally volunteer more than anything else. I mean, it began as a volunteer service much more than
Okay.
it is now. It's a Medicare approved.
Mm-hmm.
So back to Lisbon in the 60s, Medicare started in 1967. 1965, I think the law was passed. And the hospital in Lisbon wanted to be certified so that it could accept Medicare payments. And we had no policy procedure manual. And so I wrote a policy procedure manual on a typewriter.
Yeah. Yeah. Did you use whiteout on the typewriter if you made a mistake?
I think I may have. I retyped a lot.
But
Yeah.
I would think that would be sort of a fluid document in that you wrote it and then maybe 6 weeks later it changed.
Right. Yep.
Mm-hmm.
Yep.
Mm-hmm. How did you know how to even start writing a document like that?
Actually, I took the one from nursing school.
Oh, sure.
As a pattern.
And transferred it and asked my staff, is this how we do this?
Yeah.
I mean, it had to be factual.
Sure.
And now since then I've published a couple of policy manuals.
Oh,
I'm curious to know, Joan, is there a certain situation or a certain patient in your nursing career that comes to mind as a standout situation?
Yep.
In your life? Oh, who can you tell us about that?
Yep.
Without names.
Yeah, right. I'm not even sure I remember her name. She had heart. She was maybe in her 60s, and she had a bad heart. And there was nothing no, this was in the 50s. Yeah, it was in the 50s because I was a nursing student. Bad heart. Her family stayed with her quite a bit of the time. She was a dear person from Nome, actually, or Catherine. And so we knew she was going to die this one night. I mean, there was just nothing left.
Mm-hmm.
And she sat straight up in bed, opened her eyes, and said, "My God, it is so beautiful." And laid back down dead. And yes, I mean, that was just, we were all blessed, positively.
Yes, I
blessed.
guess. Oh.
Yes.
Well, I can see
that may not have been what you were looking for. But that's what you got.
Yeah.
Mm-hmm.
I can see why that's outstanding. Okay, on the flip side, then, can you, without names, tell us, give us an example of situation where it was a dangerous situation for the nursing staff to be in. Did that ever happen?
No.
Nope, not there in North Dakota, huh?
No. As far as I don't remember anything.
Do
Okay.
you remember when your first cancer patient?
Vaguely I do, because I remember the pain, and there was not a thing on earth that we could do to relieve her pain.
Oh.
There was nothing. We'd snow her and she would still hurt, even though she was comatose.
Oh my!
I do remember that.
And how she suffered, and
yeah.
And was that in the 50s?
Yeah, that was when I was in training, right?
Okay, so then fast forward to the time that you retired. Would there have been something for this lady?
Yes. Well, hospice would have been what she had, and for some of the pain, there are some nerves that they can cut depending on what and where, and
yeah.
But hospice,
Yeah,
generally is allowed to use medication in a different way.
Yes,
okay.
We've experienced that in our family.
Okay, thankfully.
Yes.
So earlier you said you had a photo that you'd like to share.
Oh.
Oh, who's that handsome young lady?
Oh, pretty gal. Look at that.
Wow.
Way back then. Right.
Yeah. Yes. What a keepsake photo. Do you remember what you were thinking when that picture was taken?
Probably not.
No. Okay.
It's one of those things.
Well, Joan, you've written a book, an autobiography. Right. Tell us a little bit about that.
The book is Options Unlimited, which was the name of my consulting firm also. Options Unlimited, we have choices. People, in my estimation, ignore so many things that they could do in life. I would guess that the two of you are well aware of that. And my book was written because I say God drops little stuff around us all the time. And if we pay attention to that, we can actually do some sort of nice things. And that was really the reason. I've done so many different things in my life. My felon came back to do his parole in Fargo again. A young man that I'd mentored for too many years now. He's been back in the pen, I think, 3 times. No relative, didn't know him at all. He's from Minnesota. People.
How did you get hooked up with this guy? How did you get hooked up with this guy?
His grandmother wrote to our church and asked if anybody would be a mentor grandma because she lived too far away.
Oh, what an opportunity.
I answered, and I said, well, I will, because I always will.
Yeah.
And he came to church with me quite a few times and was a good coffee pourer and a good dishwasher. And everybody loved him, and it wasn't very long, and he was back in the pen again.
Oh. Well, you gave it a try.
Yeah, well, I've bailed him out a couple of times. I won't do that again.
Well,
what would you say to a young student who expresses interest in going into the medical field and going into nursing? What would you say to him or her today?
That's hard to say. I have spent my life in nursing, in healthcare, and I am so ashamed of healthcare at this point in our lives.
And why is that?
It's a big corporate business now. Period. I would still probably encourage, for the few times that people really do get enjoyment from serving, I would still encourage them probably to go and try and change the system.
Are there changes that you would like to see made in the system? for better health care for the patient?
A 15-minute doctor visit with a specialist isn't worth much in my estimation. If we could get more family practice physicians who were independent, they're a whole different ball game, I think. They get to know you and your family, and they care, even in this day and age. So
and if a physician chooses not to be an independent care provider, why would that be?
Especially, they don't have to worry about as many personal things, I guess. You can just take a wage and not have to fiddle with your own staffing, not have to fiddle with those kinds of things.
Well, I think just personally, it's interesting to realize the change in the little bit that we were needed to go to a clinic in the 1950s as children. You know, you had mercury comb and you had iodine, and iodine, you put it on your wound and put a Band-Aid on.
Way to go.
Yes. And now there are so many hoops to jump through, and keep it. It can be very difficult to get an appointment with your provider.
Yes,
always.
Yes, and my thing with specialization is it's your toe that the doctor knows, and he doesn't know anything about you except that your toe hurts, and that's the only thing he's going to pay attention to. Got nothing to do with the rest of your life. That's, I guess, the piece that I think is so bad for patients.
Would you go into healthcare again if you had to do it all over?
I'm not sure if I'm not sure if I would. I'm not sure if I would. I would go into some caring thing. I'm not sure what it would be.
Okay. But your last 10 years evidently was very fulfilling.
Oh yeah. I worked 2 years after that because I was going to go into consulting, and so I worked 2 years in a freestanding nursing home, and I learned a whole lot in a freestanding nursing home compared to one that's co-located with a hospital.
Sure.
And that nursing home is where my kids will put me if I ever need to go. And I've told the nursing home that I'm coming.
Okay.
I hope not to.
They better shape up.
Keep that room open.
They couldn't get any better than they are.
Well, Joan, we're basically at the end of our conversation. This has been very fulfilling, and we can tell that your passion for patient really stands out, which is it's neat. We all need someone rah-rahing for us when we need healthcare expertise.
And I will add that right now I'm mentoring some mostly new Americans who are starting in-home care businesses for seniors.
Yes.
So this has been fun. It's been another whole learning thing.
Yes. And there that will be a necessary provision in life. We're all getting older and are needing all of those healthcare aids, no matter what your culture is.
Right. Yep.
One last question. If there was in your whole life, or if there was one thing that stands out to you that really has had an impact on your life, what would that be?
I suppose mom and dad. We grew up working hard, being loved, being expected to excel. And life is so much easier when you know you got somebody behind you.
Yes. True. Yes, very much so. Yes. Thank you. That's very heartwarming. It's a great way to end our chat. Thank you so much.
Thank you.
Jackie.
Yes, ma'am. Well, viewers, thanks for joining us. And do tell your friends, even your relatives, about this 1950s fun chat. Until the next time, toodaloo.